One of the tests we're going to use in today's lab to help identify a bacterium as a Staphylococcus is blood agar with a Novobiocin or NB disc. So in this video lesson, we'll show you how to inoculate the blood agar plate and place the Novobiocin disc on the plate. So we basically streak the plate for isolation. So we sterilize our inoculating loop as normal. And then we're going to remove some of our unknown bacterium. So we stick the loop in the auger to cool at the edge and scrape off a little bit of bacteria. And we're ready to inoculate the blood agar plate. So first, as we learned in a previous video lesson, we're going to spread the bacteria over sector 1 on the plate by going back and forth. At that point, we're going to sterilize the loop, kill any bacteria that are on the loop. And we're going to stick the loop in the auger to cool. Then we're going to rotate the plate so the bacteria up in sector 1 are now sitting at 9 o'clock instead of 12 o'clock. Then we're going to take our sterile loop and spread the bacteria in area 1 over area 2. We'll drag it through maybe 2 times and then spread that out without dragging it through, covering sector 2. Then we're going to sterilize the loop again. Stick in the auger to cool off to the very edge. Rotate the plate so that sector 2 is sitting at 9 o'clock. And we'll take our sterile loop, pick up some bacteria from sector 2 by dragging it through a couple of times, and spread that out over sector 3, being careful not to touch sector 1. So that's our normal streaking for isolation that we learned earlier. However, with blood agar, we always stab the agar. Some of the hemolysins are inactivated by oxygen, so by stabbing the agar, we can get more hemolysis more rapidly. So once you've streaked the plate, you don't have to re-sterilize the loop when you're done with sector 3. Just take your loop and make a couple of stabs in each of the 3 growth areas. And then we're done with the inoculating loop so we can sterilize that. Now what we're going to do is place the Novobiocin disc on sector 2 of the plate. And to do that, we lift the lid. Now the way the dispenser works, when you push down on the handle here, that will eject a Novobiocin disc. So we hold it over the area where we want the disc. We push the lever down, the disc comes out. Then we're going to take our inoculating loop and just gently touch the disc so it makes good contact with the plate, so that when we incubate the plate upside down at 37 degrees, the disc doesn't fall off. So at this point, we're ready to incubate the blood agar plate.